Yeah.
All right, good afternoon, everybody. It's great to be with you. Laura and I are super excited because this is really the first time that we at DHCS are coming to you, plans, to talk in a little more detail about Medi-Cal Connect, previously known as the PHM service. So in the chat, go ahead and I think we can probably see your names already, but go ahead, put your name and where you're coming from. We do have a list of everyone, but it's just nice to share with each other where you're coming from today. And my name is Yoshi Lang. I am a family physician in quality and population health management, and I'm also the project executive on Medi-Cal Connect. Dr. Laura Miller is our assistant project executive, and we have 5 work streams. She is over our user and stakeholder engagement work stream. So that's why Laura is with us today, and she'll take the second half of this presentation. And then in absentia is our relatively new division chief, Hope Neighbor, and she wanted to join, but unfortunately is sick today. But Laura and I got it covered. Okay, I'm just looking at a couple of the names and where y'all are coming from. Hi, Kate. It's been a long time. All right. Hi, Claire. And hello to a bunch of new friends. Okay. All right. Let's go to our objectives. So today, and I wanted to mention we are recording. So just want to make sure you're aware. Objectives today, we want to make sure you all understand at a high level the goals of Medi-Cal Connect, aka PHM service, the functions, and then roles and responsibilities for all of you as early adopters. You are part of this special group of folks from plans who we, for various reasons, trying to get a good sample across the state. You are the early adopters who will help us figure out where to focus our efforts as we get ready to roll out the service. And then we'll share with you our value propositions, initial value propositions, and then we'll talk about next steps. So you can give us real-time feedback in the chat. If you have questions, you can put those in the chat. We're hoping to have a little bit of time for Q&A at the end, and we will also save those questions. We are working on an FAQs, so your questions that we don't get to will help inform what we put in the FAQ. All right. The next slide is the agenda, but it's really kind of a repeat of the objectives. So I think we can just keep moving to vision, goals, objectives. Oh, go back, please. Before I show you a slide full of text, I just want to say the way I say it to like family and friends if I'm trying to explain what Medi-Cal Connect is, because it is such a complicated project and concept. And we've been playing around with tagline and communications. We do have a professional comms vendor coming on board, but in the meantime, our humble, DHCS and Gainwell, who's our vendor, our team has been figuring out how do we summarize what Medi-Cal Connect is. And the kind of one-liner that I have embraced is this. We are, with Medi-Cal Connect, uniting data from our trusted partners to close gaps in services and improve lives. So it's all about gathering data to close gaps in services and improve lives. That's what it comes down to. And if I were to take it one level deeper, it's about gathering all this data from various stakeholders across the state, and then making all that data available to the same stakeholders, including members, so that they can improve health. Okay. That's how I would say it to sort of family and friends. And now on the next slide, and go into a little more detail, which I would not share with family and friends, but I want to share with all of you. So formally stated here, the vision is that this is a data-driven business solution. It's going to support whole person care by integrating information from our trusted partners across the state to support pop health, and then also allowing multi-party data access and sharing. So that means you all get the data as well. And then I think about it in 4 buckets of objectives. So first and foremost is actually about member experience and focusing on members. So we are going to provide members with a tool that will likely be some type of web portal or app, and that's going to allow them to access information, better understand their benefits and eligibility, and then streamline access to get those services and to get the care they need. The second bucket is about whole person care. So that's about improving the health of our members by leveraging all this data and addressing their risks and unmet needs. So I'll use the example of WIC and CalFresh kind of maybe throughout this presentation a little bit. So for members, they're going to have a portal where they would see something like, oh, I'm enrolled in Medi-Cal and I have dental benefits. And oh, here it says that I likely qualify for WIC and CalFresh. And oh, here's the link where I go sign up. And on the plan side or a care manager side, they would be able to access their version of the portal and they would see, okay, here are members that don't have WIC and CalFresh and likely are eligible for it. So we're going to help them sign up. That's what is meant here by actionable insight. Third bucket is really powerful and exciting, the population level insights. So we are going to have both at DHCS and the plans, we'll have analytics and dashboards where we can see population health trends across the state and be able to act on those trends. And part of the vision that I think about from the perspective of plans is now you will also be able to see what's happening right in the rest of the state compared to your member population or compared to other plans in aggregate. Fourth bucket is policy making. So by leveraging this data, we're going to be able to make better decisions regarding policies and drive health equity, drive quality in the care that we provide to members. So that, I gotta take a moment. That's the vision and objectives. I do also want to add that Medi-Cal Connect, it's going to evolve. You can tell that there's so much potential here, and part of what we're doing in the coming year is figuring out where to focus, and then we'll figure out what else can be added on in the future. Last thing I want to say before we leave this slide is what Medi-Cal Connect is not. It is not a real-time EHR or health information exchange. That is generally not the purpose of what we're trying to do. Okay, moving on. Go into a little more detail on the overview. This is just to illustrate that the PHM program and Medi-Cal Connect are kind of like two sides of the same coin, where PHM program are policies, which have largely been focused on MCPs. And I know we have folks here from behavioral health plans as well. And then Medi-Cal Connect is kind of like the data backbone for PHM program. But in that second box on the right, Medi-Cal Connect includes programs and infrastructure that extend beyond MCPs. I mean, this Medi-Cal Connect is going to be able to do a lot of things that apply beyond just PHM program, right? So we will be working with behavioral health plans. There are definitely implications that go to BH transformation. And then we'll have data from California Children's Services, so CCS, IHSS, things that definitely go beyond PHM program, but they're very close together. And then timeline, PHM program, that went live quite a while ago. As DHCS, we'll show you the timeline, but basically DHCS internal users will get some functionality later this year, and then plans will get it next year, and then we'll get to the timeline. Okay, next slide. All right, here we're showing that we're supporting whole person care. So physical health, behavioral health, social services, and right at the center are members. And then these are just examples, right? The plan is we will get data from CDCR on corrections. We will get HMIS data about housing. We are going to help plug in people to ECM who get identified as qualifying for ECM, various social supports, right? Community supports and others. And obviously health, we have claims and encounter data, and then food, CalFresh, WIC, right? All of these things, and that's not everything, but those are some key examples. And again, members are going to have an easy to use platform. They're going to be able to navigate benefits, get to those services, close those gaps. They're also going to be able to update contact information. And for those who some of you might have been in the member and contact demographic information sessions that we led a while back, but this is where it ties together on contact information and trying to have all of us plans, the state, be able to get accurate contact information so we can actually reach our members and give them the services they need. All right, next. This is outlining an overview of capabilities, a lot which we touched on already. I sort of think about it from 1 and skip to 3, which is we're integrating data from all these sources, and some of them are listed there. And then we're providing access to all these data sources, right? That's number 3. And then the purpose of all that, right, is number 2, which is enabling those PHM functions and services. I have not mentioned in number 2, risk stratification, segmentation, and tiering, RSST. So that's the one component I think probably many of you are aware that plans, I should say MCPs specifically, will be required to use our RSST algorithm. We know that many of you already have an algorithm. And so in that case, you can use both. And more information coming on that soon. All right, next slide. Okay. Here is a high-level overview of capabilities that we may include. And I say may because the original contract is super ambitious, to be totally honest. And like I said, in the coming year, we're really trying to figure out what to focus on. I should actually say now we're trying to figure out what to focus on. And the input feedback from all of you will help us focus in on what we think is really important. So you can see the buckets here: RSST, screenings and assessments. This is about collecting them, viewing them, and exchanging them. I'll talk a little more about that. Care planning, so to be able to view who is the care manager, what's their contact information, be able to look at care plans from other entities and exchange care plans with other entities. Then plans will have their own portals. They'll be able to see updated member contact information, be able to message members potentially. And then you'll have access to these dashboards, which will include, but not limited to, quality, condition prevalence, health equity at a state level. And then there's kind of a miscellaneous data sharing bucket here as well. Okay, next slide. So data that we will include. Again, this is a list of data that we may include, and I won't read it, but you can see the big buckets here of healthcare utilization, behavioral health, demographic and socioeconomic data, and social services. So the examples of WIC and CalFresh are the ones that I like to use, because when I've heard from plans, that's one of the most enticing pieces of data that we could get as this at the state that plans, as far as I know, don't have already. I'll give you another second to look at that list. And I'll tell you, we are working hard to get all this data. That has been one of the biggest tasks of this whole endeavor. All right, we can go to the next slide. Okay. Screenings and assessments. We are aiming to streamline collection of screenings and assessments, and support development of care plans and data sharing. And so J.C. Cooper, our former, now I'm losing track of the titles because they've changed, but essentially our deputy of Medicaid, Medi-Cal, said, I don't want a member to have to fill out a screening or an assessment form and then go to some other location, some other entity, and have to do the same thing or answer very similar questions when they may have just done it the week prior. So our goal, part of our goal vision is that, right, a member fills out the screening assessment once, and then other entities, appropriate entities with all the needed security components are able to see the same result, and then the member doesn't have to repeat that screening. So the 4 screening tools here are we're planning to include in Medi-Cal Connect, and I believe these are also mandated by DHCS. So these are examples of the screenings that we're going to try to implement in this vision. Okay. I'm almost done talking. 2 more slides. Apologies for the microscopic font here, but hopefully you can zoom in if you needed to. So the original plan, I was chuckling to myself, the original plan is that we were going to do this in one big bang release. We scratched that after we essentially formed a new team, and we said, scratch that, we're going to do this in 5 releases. So that's what we're showing here, is that we're planning for, in July, we're going to have a limited group of DHCS users getting their hands on these initial dashboards. And you can see the core business practices and capabilities here. Those are listed comprehensively in the appendix, and I believe we will share these slides. So if you want more detail on the business practices capabilities that were outlined in the original contract, that's what I'm talking about. And so that's where these come from here: population health management, advanced data and analytics, regulation and compliance, business support services. All that will go live for a small group of DHCS users this summer. And then by the end of the year, our plan is to roll this out for all our DHCS users. And then you all, plans, state partners and agencies, will get this in the second quarter of 2025. And I've already talked ad nauseum about what those capabilities will be, or at least we hope will be. And then release 4, it's going to go live with another set of external stakeholder or partners out there in the state. And then release 5 most importantly, members at the beginning of 2026. And we made a very intentional decision here. We said members are going to go last because we got one chance to do this right with members. If we put something out there that's not working very well, then we kind of lose our chance with members. So we wanted to get everything right, test it out internally first, and with our trusted partners, the plans, as our kind of first stakeholder, and eventually get to members. But the engagement with members is going to start very soon. So getting input from members is happening. Okay, my last slide, we call this the egg or the hazmat slide. What this is just showing is members at the center of our efforts. And then these boxes just go back to slide 5, which is about those buckets of objectives. So that's the number 1, that's the same bucket of member-facing objectives of the service. Bucket 2 is you all as the Medi-Cal plans, both MCPs and mental health plans. And box 2 being functions and objectives for you, and then box 3 corresponding with DHCS. The whole person care, if you're paying attention closely, is not here, but that's because the whole person care kind of spans all 3 of these hazmat spills. Okay, so just illustrating here, members being the focus, and plans supporting the health of members, and DHCS supporting plans in support of members. All right, that I am done with my part. You can continue to put questions in the chat. Yes, Gainwell Technologies, I'm just seeing that now. And I will hand it over to Dr. Laura Miller. And Laura, why don't you introduce yourself one more time for people who may have joined late?
Absolutely. So good afternoon, everybody. My name is Laura Miller. I'm a primary care internal medicine physician at DHCS in quality and population health management with Yoshi, and I have the honor of being the lead on the user and stakeholder engagement for Medi-Cal Connect. It's been a journey to get to today, and I'm really excited to be here and begin this engagement. It really is a conversation about what are the needs and pain points that the service can support you with. So you all are here because you are early adopters. Just a sidebar, this call is for plans, both Medi-Cal plans and mental health plans. If you are a state partner, an agency, or other non-plan person, there's a whole nother call for you. You're welcome to be here, no exclusion, but this is somewhat of a plan-focused call. So you have another opportunity to hear from us. So yes, this will be sharing what it means to be an early adopter, sort of what are the benefits, the responsibilities, and really what to expect in terms of timeline and time commitment. Next slide, please. So here you'll see the early adopters. Hopefully we have representation across the board from all folks listed here. If not, we'll do some chasing and try to get everybody into the fold. The inclusion of entities here was really based on multiple factors, including performance, size, geographic service area, plan model, etc. So that is why you were here. And what we really wanted was representation from all types of plans and counties in the Medi-Cal program. When I first came here, somebody told me, you know, Laura, solving a problem in LA and Humboldt County, it's different. So we really wanted to have broad representation. Next slide. I love this slide. It's sort of like, it's a risk-benefit analysis. We want to talk about benefits and responsibilities. We really want your collaboration and engagement. You can really help us get this right. We want your insights and feedback. We want you to engage on functionality of the service. Is this service going to solve problems that you have? How can we take the capabilities, refine them, and really get it to work for all of us? You will get advanced information about the service. You'll have input, and I think that's really exciting. Over the next several months, there's different kinds of forums that we'll be engaging you in. There will be 2 to 5 meetings over the course of the next 10 to 20 months. And we'll also have different kinds of sessions, and attendance at those sessions will evolve based on needs, based on your interest. And we really want you to help us identify gaps. We want to get this right. We don't, and we really need help to do that. Next slide. This is just a brief overview of the kinds of forums that we'll have. There will be webinars akin to this one. We'll have working sessions where we really sit down and look at use cases. We'll have listening sessions, small group discussions, feedback groups. So as I say, there are a number of different forums that you all will be included in for this. I think next slide, let's absolutely go to the timeline. I think that is what people have been really wanting to hear about. So Yoshi alluded to the releases over time. We have 5 releases. Release 1 and 2 are DHCS releases, the orange dot. You all here are in release 3 for the managed care plans, the county mental health plans, and state partners and agencies. In a way, I think of it, that is when we really go public with release 3 in Q2 of 2025. Release 3, right. And then release 4 is in Q3 of 25, and that is the school bus yellow dot. Other partners, essentially, other delivery system partners. And then finally, release 5 in early 2026, that is for members. So these dates are tentative, subject to change, but we really want you to have sort of a roadmap of what we're thinking about. I'll go back to the arrow now. You'll see the webinars. Webinar number 1 is right now. You are in this very first open circle here. Webinar 2 will be in Q3, and then webinar 3 in Q4. Invites will be sent out with 30 days in advance. So it'd be awesome if you could, we will let you know the content of webinars, but it would be great for you to bring appropriate partners from within your plan to those webinars. I think it'll be super, super important. And everybody will be invited to the next webinar 2 in Q3. And some of you will be engaged prior to that. So hopefully that helps. I know there's been a lot of intense speculation about what the timeline is, and we're feeling pretty good about this. Like any massive project, things can slip, but we're looking pretty good. Next slide, please. And thanks for handling the chat, my colleagues. So we're going to dive now into value propositions. And I think most of us are familiar with value propositions. They're essentially like scenarios, pain points, issues that we want to solve. So we're going to dive into that with the next slide. Early on in this process, we talked about Mad Libs in that, the user uses a capability to do an action to provide a value. Value propositions are essentially like that. They're written descriptions of how stakeholders can benefit from using Medi-Cal Connect. So we're going to be talking about these value propositions and really opening up a poll and getting your initial feedback on this. Your input is really going to help us identify core areas of interest and prioritize those that are most effective for you. And it will help us shape Medi-Cal Connect so that it can be the most beneficial to you and your members. Value propositions, again, will help us achieve goals, including cataloging and prioritizing the various value propositions. Next slide. I'm going to give you a minute to absorb this because you do not need me reading to you. We have identified 5 value propositions as they relate to Medi-Cal plans and county mental health plans. So let's just take a few minutes to read this, and we'll be going over these and asking you to prioritize. So I will be quiet for a whole minute. A minute is a very long time. I think I did it. Um, let's move to the next slide, and you won't lose this text. So we're going to go next into really getting your feedback on the value propositions. So let's flow forward. So we're going to do some live polling. So pull out your cell phone, get ready for the ever-present QR code. In these exercises, we'll be asking you for feedback on our assumptions. We'll ask your help to prioritize key elements and capabilities of Medi-Cal Connect. We'll be able to pinpoint additional capabilities that will help the service be adopted. We'll identify stakeholders for additional sessions. And another huge point is we really want collaboration here. So the polls will refine our priorities. We won't be taking away priorities, but we will be aligning them. Okay. So here are the value propositions. It's the same from that prior slide. So no quizzes, you'll just be able to read it here. But please do pull out your cell phone and go to this QR code. Yes, Phoebe in the chat is saying you can paste that poll link into your browser, or you can scan the QR code. Thank you, Phoebe. So this is least value. Which one would you put to the back? So our support team, who are amazing humans, they'll let me know when the poll is getting itself ready to be seen. And as if by magic.
You, Vincent.
Yeah, exactly. Thank you, kind sir. Okay, so least value, it's really looking like the RSST, the segmentation and tiering. And this isn't surprising to us. We've heard this, that, most of the Medi-Cal managed care plans do have some sort of stratification algorithm, sometimes very sophisticated. I don't know if we'll be able to break down these answers, but possibly this might be a little different for the behavioral health plans. And I don't know if we're all in yet. But certainly contact information is getting some interest. And then the member information was there and disappeared.
I didn't know you could take back an answer on the poll.
I didn't either. So I think that if voting is basically complete, do we think it is? Maybe Phoebe, if you can pop something in the chat if you think we're complete. I don't want to spend all our time. Okay, I see a thumbs up. Thank you. I'm super glad the technology worked. This is awesome. Let's go to the next slide then. And then this is really, maybe let's take down the poll everywhere for a second, because we want to look really well at the value props that hold the most interest. again, it's super nice to be able to read those again. Awesome. So the next slide is most value. So we can, there we go. So this is really, nope, I want slide 26, please. I'm sorry. Which of the values, so this is 27, I believe. So let's hop back to 26.
This is 26, Laura. What?
Okay. All right. My apologies. Okay.
Okay.
So it's really similar to the prior. It's a poll on which ways do you think you will be using Medi-Cal Connect the most? Again, what of capabilities that may be included, what do you think you would use? And we'll give some time for polling, and then we will pop to the answers. All right, we'll hop to how people are seeing these. Okay, great. So around what people think will provide the most value. This is great. We've got some diversity of opinion. It looks like member data, member information and data that you might not have. And that really resonates. We know that care is fractured in multiple silos. If we can just break down some of those silos, we can really do whole person care. So lots of interest in member information and data. Some interest in reporting capabilities, which is great. And again, I think it's really important to think about the data sharing. You know, the population health management strategy and the new Medi-Cal contract and the multiple MOUs between entities. All of those really rely on data sharing. So that's I'm glad that there's interest there. And then member information. Awesome. All right, let's go to the next slide because we have one more polling. Yeah, we just did there we go. Which ways would you be using Medi-Cal Connect? The RSST for screening and assessments, care planning, Medi-Cal Connect portal, etc. What of these elements to be included do you think you would use? And we'll do the poll and we will see the answers in just a little bit. We give a chance to sort of think about those. The magical Vincent knows how the polling is going, so maybe we can see that slide, that view. Let's see. There's some interest in the portal. We'll actually go through these and do some totaling up to see which ones are of most interest, but it's nice to see a variety of elements, that we've got some variety across the board. So that's awesome. And somebody said all. That is delightful. Thank you. We put a lot of planning into this party. I'm glad you want all the dishes on the table.
It's a big party.
It's a big party, let me tell you.
A lot of dishes.
Lots of dishes. We're still gathering some ingredients, but we're definitely cooking up a party. Vincent, do you think they're slowing down at this point? When you think they're slowing, let's pop back to the what is actually the last slide here, and then we'll have time for questions. Okay, if we can hop up that last slide. So this is, we're going to just talk about our next steps. We've done a whirlwind tour of Medi-Cal Connect. And really, we've gone from vision through through capabilities, through things that we will be able to deliver. So let's go to the last slide, which I know there's a funny thing going on where I'm not seeing the slide. I'm not seeing slide 28. There, now I am. All right. So our next steps. Thank you all, early adopters, for coming. And really, this is the first step in our engagement with you, and we're really excited and we're grateful. I know that this is time out of your incredibly busy lives, and we really, really want it to be beneficial for all of us. We are sending out a survey to all plans, so not just early adopters, but everybody, early next week, to really assess sort of where they are, what's going on. You, as an early adopter, will receive that survey, as well as will folks who aren't on the early adopter list. We will be doing future sessions and topics based on results from this survey and from today's polls. Specific plans will be invited to participate in small discussions and focus sessions starting as early as mid-June. And then the next webinar is for everybody, all early adopters, in October. So if you have additional questions or recommendations, we have a little bit of time at the end here. We know we can't get everything in the little bit of time that we have left, but you can use the Medi-Cal Plan survey to get feedback to us. So I think at this point, we'll be able to open it back up to some questions and answers. I've been talking, so I have not been looking at the chat. So maybe we'll ask Yoshi to take a look and moderate.
Yep. And actually, it's been light on questions, so feel free to add them back in. We got two excellent and related questions, which the first one was, how is this related to the data exchange framework? And the second was, how is this related to QHIOs? So I will give you my best answer. However, we will also put this in the FAQs and come up with a better answer to what I'm about to say. So the data exchange framework, in my understanding, the emphasis is really on getting all these healthcare entities to share data. It's basically saying, yes, we will share data. From what I know, data exchange framework is thin on the technical details of how that data will be shared. And that's what we're doing with the service, is we are laying down the pipes to facilitate data exchange for our partners and for members. Data exchange framework, definitely not for members. And QHIOs are very much, as far as I know, related to data exchange framework. And the QHIOs are getting data. I pulled up data exchange framework website, but examples are hospitals, physician organizations, medical groups, SNFs, health plans, disability insurers, clinical labs, acute psych hospitals. Right, so you can tell it's really healthcare focused. And the data from those, I believe, will go to these QHIOs, and then, right, the data will be shared that way. But my understanding is it's more clinically focused, and also it's not limited to Medi-Cal. And Medi-Cal Connect is for Medi-Cal members. So that's another big distinction. Let's see what other questions. Can you provide some additional details on what the adult screening tool and youth screening tool that would be in scope for the streamlined? Yeah. Yeah. So part of the answer is that the specific list of which screening and assessments is not finalized. And the adult screening tool, youth screening tool, those are, hopefully my memory is correct here. Those are the tools that a member has to fill out when seeking behavioral health services. And Erica, I don't know if you're from a behavioral health plan or an MCP, but that's my brief understanding. And Katie, you're referring to universal screening using the adult or youth screening tool. Is that right? Sorry, you can't unmute yourself. That's what happens when it's a webinar format.
And these are things that are, we are working on, and a lot of it, your feedback is important. How would you use it? How would it interface? Can it smooth out pain points for you, essentially?
I'll share another example that we're exploring. I would say exploring because it's not something that was in our original contract, but realized that it could be a huge win. Is something like the CANS assessment, which, if any of you remember the acronym, please pop it in the chat. But it's an example of where healthcare folks and Department of Social Services folks, they both use this assessment, but they don't have an ability to share it with each other. And so that means that these families got to do the same potentially traumatizing screening and assessment multiple times when they go to different entities. So that was an example that we're looking at. Oh, thank you, Jamila.
We got 3 people tossing it in. All right. And that's one of the points that we've heard a lot. And a key point of the service is, we want to be doing the screening, but we don't want to ask people over and over and over again, about traumatic incidents. So if there is a way that we can have a central repository of that such that the questions don't need to be asked again and again. Updates can be asked, right? But it would come from an informed place, a knowledge that there is already a high ACE score or challenges, et cetera.
And Kathy is joining us virtually. Kathy is our lead on the Gainwell side of the effort. So she's in charge of the folks that are actually building this thing. I'm in charge of all the DHCS folks, essentially outlining and supporting how we get it done.
But I think, yeah, Kathy's point is well taken in the chat that Medi-Cal Connect is not an HIE, it's not an EHR. And that the QHIOs will serve as the HIEs with that type of healthcare data. And Medi-Cal Connect will be able to share back and forth.
And Erica, yes, you are right. RSST will create a high, medium, or low risk tier for each member.
And Claire, I see your question around seeing the data and HIPAA safeguards absolutely in the planning process. All of the permissions are actively being worked on now. Obviously, those are guardrails that we're working within most definitely, as well as data security. So I think that I can't tell you exactly who can see what, but Claire, your Kaiser, you won't be able to see members in other health plans, etc. So we can come back with more on that. There'll be lots more as we come down the pike. Uh, Again, Jennifer Sales. You may some of you may know Jennifer. She's working with us on this. She's got a great piece in the chat about more around Medi-Cal Connect and the vision, a longitudinal source of data on Medi-Cal members. We will absolutely get answers to all of these questions in an FAQ. I think at this point, we're pretty much ready to wrap. I'm looking at Yoshi. Sounds like a plan?
Yeah.
Yeah. And again, we really want to thank you for your time, your engagement, and we're starting a journey. Many of us have been in healthcare for a really long time, so it's been a long journey up to now. But I'm really excited about this. I think this is really a chance to break down silos and not just say whole person care or person-centered care, but actually do it and have the data structures and framework to be able to do it. So much appreciated, and we will keep seeing you. Thank
Thanks
you
so
so
much all
much.
again for your time. Have a great weekend.
Thank you.